Next question is from John DePetro. Governor, why not treat high infected areas in the state and residents in those areas differently than other areas? Why treat Block Island, Narragansett, and Newport the same as Providence, Pawtucket, and Central Falls? Will any stimulus money go to undocumented people?
Okay, that's a lot of questions.
Two different questions.
Leave it there so I can keep my eye on it. So in some ways we are treating different communities differently. For example, we have a walk-through clinic in Central Falls. Why are we doing that? Because we have reason to believe that in that community there's a high incidence, people haven't been tested, they don't have cars, they can't get to Twin River, so we went to them. Same thing for Woonsocket and Oneyville and other areas in Providence. In other ways, it just doesn't make sense. You know, in a much bigger state, that might be something that we could do. Like, for instance, I know in New York, which is a much bigger state, obviously New York City is very, very different than some of the upstate, more rural parts of the community, and people don't interact. Rhode Island is, as you know, as we all know, it's a small place. It's extremely densely populated. I think we're the most densely populated state in the country. You can get almost anywhere within an hour, which is one of the reasons we love it. But it means that it doesn't really make sense to have different, like county by county regulations. And frankly, it would be very difficult to enforce. So that's why we've made the choices that we have made. We haven't yet decided about the answer to the undocumented population. Here's what I will say. I'm concerned about it. I am quite concerned about it. Folks who are undocumented are afraid, and they're afraid to get tested. They're afraid that when they go to a testing site, there might be an immigration official there. We are working overtime to let the community know that's not going to happen. They should get tested. They should see a doctor. They should see a doctor if they're sick. If they need a place to live, if they're a healthcare worker, they should let us get them to Brown University. And so I'm worried that because they're afraid they're not going to get the care they need, they're going to continue to spread the disease, which is bad for everybody. So I want to make it clear, regardless of your political views on immigration, I promise you it's in the interest of every Rhode Islander, in the public health interest of every Rhode Islander, that everybody gets tested and is logged in our contact tracing system and gets the support that they need. And so how we do that exactly is an evolving thing, but we're working on it every day.